Not everyone is on Medicaid, but according to Pew Research, 1 in 5 Americans are on Medicaid. And with Medicaid cuts on the table, 57,000 Nebraskans could be affected. I'm Melissa Wright in North Omaha. I spoke with the doula about a new program specifically for doulas at IB Black Girl to help them be reimbursed for their services. Programs like this could also be at risk. Sydney Shedd, a North Omaha doula, says while the future of some Medicaid coverage is up in the air, this young program that provides coverage to expectant moms in her neighborhood is worth exploring.
I think it's worth giving a shot, but I think it's definitely, we still would have a long way to go, even if we were allowed to have that component to doula work.
Angie Lauriston with Nebraska for Us says the House-passed budget reconciliation bill is a cause for concern.
And so we know that there's going to be a huge burden on the state of Nebraska in order to comply with what passed in the reconciliation bill.
The bill meant to fast-track federal spending changes includes $700 billion in Medicaid cuts, which could ripple through programs that rely on Medicaid reimbursement from clinics to support services.
You know, just isn't always there, whether you're talking about SNAP or Medicaid or Title 20, et cetera.
What we knew historically, what we knew yesterday was that 3 hospitals in Nebraska will close. Services will be cut from different clinics and hospitals throughout the state.
Right now, the program hasn't heard of any canceled funding. They're just preparing for the possibility. Progressive groups like Nebraska for Us now telling people to call their senators if they're concerned as the big bill heads to Senate. I'm Melissa Wright, your North Omaha neighborhood reporter.